A UTI is an infection in the urinary tract which can lead to major health problems if it's left untreated. Joining us this morning to share more about symptoms and treatment options is women's health nurse practitioner Isla Shebar from Pioneer Valley Urology. Isla, it's wonderful to have you here. People may recognize your name from Ask Isla in the newspaper. But today we're talking about UTIs, an infection in the urinary tract. They're most common in women, more so than men. Why is that?
Women are actually about 10 times more likely to get a urinary tract infection than men, and it's usually anatomical. Women have shorter urethras, which makes it easier for the bacteria to get up into the bladder, and also women's urethras are closer to their rectum, and that's often a cause, the cross-contamination.
So you mentioned, we were chatting earlier, E. coli is the main issue or the main cause of it.
It is the most common bacteria, and it is present in the GI tract, so that cross-contamination is the problem.
And what are the risk factors of UTIs? I mean, some people get them more often and more frequently than others.
Well, as I just said, being a woman is a risk factor. Sexual intercourse, either frequent or intense or with a new partner or multiple partners, can bring it on. And postmenopausal women are very prone to urinary tract infections. The loss of estrogen after menopause changes the pH of the tissues down there. Also, not emptying your bladder on a regular basis, holding on to urine, makes it more likely for germs to grow in there. So anything that causes a problem with emptying urine, either an obstruction from stones or masses or tumors, or anything that keeps the bladder from contracting well, like MS or stroke or spinal cord injury, or in men an enlarged prostate, can make it difficult to get the urine out. Also, being diabetic increases your risk, being pregnant increases your risk, being incontinent, and use of catheters, whether long-term Foley catheter or intermittent catheterization.
Now, what are some signs and symptoms that people can see as kind of, oh, maybe I do have a UTI and I should go to a doctor?
People often complain of burning with urination, a foul smell, cloudiness to the urine, or blood in the urine. They can have pain in the back, under the ribs on one side, fever, shaking, nausea, vomiting, frequency, urgency, needing to void often but in small amounts and not really feeling empty.
So if any of those signs or symptoms you're noticing that, you should definitely see your doctor. Now we're just about out of time, Isla, but let's talk about if you do have a urinary tract infection and there's no signs or symptoms, should it be treated?
If the patient is pregnant, absolutely they should be treated because it can cause problems for the mother and the child. If they're not having any symptoms, we tend not to overuse antibiotics. Patients are often colonized, and using antibiotics won't change the course of that.
There are many treatment and prevention options, and we'll make sure that we put those online. People can also reach out to you at Pioneer Valley Urology for more information.
Absolutely.
Thank you so much, Isla. Wonderful to have you here.
Thank you.
And for more information on Pioneer Valley Urology, call 413-241-2100. You can also visit them online at pvurology.org.